the patient into the ambulance. In this skill, we're going to place the patient on a long spine board. We will simulate that this patient does have a neck or a back injury. So I will assist the providers as a third provider in providing a safe moving operation of this patient. The first thing that we've done is we've placed a C-collar on this patient. The next thing we're going to do is we're going to log roll this patient. Once again, we want to use good, safe lifting and moving techniques, which we'll talk about as we load the patient onto the long spine board. The first thing that we're going to do is Matt and I are going to position ourselves so that we can log roll the patient.
Are you guys ready to roll?
Joe's going to call out the commands for us.
Towards you guys on 3. 1, 2, 3.
We're going to protect our backs and also protect the patient. And at this time, Matt's going to go ahead and palpate the back and make sure that we don't have any complications back there. Matt and I have kept our equipment close here so that we can maneuver it right into the back of the patient to place the patient onto the long spine board. We'll roll it up to the patient, and then we'll let Joe call the move so that we can move the patient back down.
Okay, down on 3. 1, 2, 3. We're good, guys.
Good? Okay. Once we have the patient in the position that we want the patient on the long spine board, then we will use the securing device. In this instance, we're going to use what we call spider straps to secure the patient to the long board. Once we have secured the patient to the long board, we can go ahead and secure the patient's head to the long board as well so that we don't have movement of the head. And Matt and Joe will work on that in conjunction with each other. And then following your local protocols, you will provide the proper assessment for this type of a patient as you have place them on the spine board to protect their neck or their back.
All right, Matt, are you ready to lift?
From here, Matt and Joe will once again use the proper lifting techniques and move the patient on the spine board to the wheeled stretcher.
Up on 3. 1, 2, 3.
From this point, we're going to go ahead and secure the patient to the wheeled stretcher. So they use the securing devices on the wheeled stretcher and secure the patient. Once they have the patient secured to the wheeled stretcher, they'll raise the wheeled stretcher into a transporting position and then load the stretcher